Hello everyone, welcome to the 52nd episode in our AI and You podcast series. Today is Monday, April 5th, 2021, and I'm your host, Vicar Saidi. I'm a computer scientist and engineer, a lecturer and a consultant. I'm also the author of several books. My most recent book is about artificial intelligence and is titled The Genome Affair. The Genome Affair is a speculative work. It examines what the world might be like if some of the more extraordinary capabilities forecast to be realized in AI over the next 20 to 30 years were actually realized today. Given the growing list of frightening existential threats humankind now faces, the book pays particular attention to the impact AI is expected to have on world affairs. The book is available in ebook format for those who prefer to read on a digital device, but it's also available in a high-quality paperback edition. The Genome Affair is available on Amazon, so I hope you'll take the time to read it and to leave a review. Amazon book reviews are very helpful for writers. I'm very interested in how science and technology influence world affairs and the big questions facing humankind. Studying at the confluence of the great disciplines of human history, political science and thought, international affairs, science and technology, offers a deep understanding and pedagogically important lessons of how advances in human endeavor have influenced and impacted civilization. I'm available to give talks on artificial intelligence and its related technologies, and on the impact AI is expected to have, or is already having, on our world. If you'd like to get in touch with me to arrange a web-based event or consulting meeting with your company or organization, you can find my contact info in the podcast notes below. Please make sure to subscribe to my channel, like this video, and share it with others if you find the content valuable. Thank you. And now, on to today's podcast. In our last podcast, episode 51, I spoke about whether global government is an idea whose time has come. In today's podcast, episode 52, I'll talk about the impact AI will have on healthcare in the future and whether it will be more equitable. Let's get started. In the coming years and decades, as artificial intelligence is increasingly integrated throughout our healthcare systems on its unmistakable trajectory towards ubiquity, our processes and protocols for managing health and the onset of disease will be far more preemptive and proactive than at any time in the past. We will no longer wait for people to fall ill before initiating treatment. Rather, sophisticated AI-enabled health systems will constantly monitor patients from birth and diagnose disease at the earliest sign. These AI-enabled health systems and tools will leverage vast quantities of continuously expanding troughs of data to advise patients and physicians early and accurately, thus rendering the AI agents far more effective than previous public health systems in containing disease. Nevertheless, there are significant hurdles that we must overcome before we can realize this vision in the United States and the developed world. Consider, for example, a time in the not-too-distant future when a child is newly born. AI-enabled systems will routinely perform a comprehensive panel of checks and tests to assess the infant's health. Following this screening, if genetic mutations are detected in important genes, the infant's patient records, its EMR, will reflect these anomalies and doctors will be alerted. As the child grows, AI agents will silently monitor this mutation and other anomalies along with a comprehensive set of critical health parameters. If a genetic mutation begins to evolve into something more nefarious, the change will be detected quickly, and a thorough diagnosis will be initiated and performed to evaluate the patient's condition and risks. Then, a physician will be engaged to consult with the patient and arrange for a therapeutic plan. However, for such an AI-enabled system to work, it will require a very substantial health parameter dataset. Once such extensive and patient-relevant data is available, the AI agent will be well equipped to help in directing medical practitioners and patients towards a personalized treatment plan. This plan will be optimized to work in a specific patient's situation and profile. The agent will have acquired this ability by studying data from a vast population of similar patients. This new approach will harken a revolutionary change in healthcare, a future of personalized medicine. As noted above, one of the main limitations in implementing such a system today is the insufficient volume of relevant health data. Health systems will need to collect dramatically more data in order for these AI agents to function well. Unfortunately, this issue is currently being exacerbated by the lack of diversity of patients in the American health system due to economic limitations, which lead to health system access problems for certain populations. In effect, U.S. health data is currently biased by the racial and ethnic backgrounds of patients who can afford to use the health system versus those who cannot. But bias can take many forms and cannot be resolved by simply ensuring data is collected from a wide range of demographics. In fact, to work well, the AI agents in this capacity will need to receive health data from people from as many ethnic and racial backgrounds as possible. The extreme fragmentation of healthcare delivery in the U.S. is also a very serious hurdle that must be overcome before acceptable levels of health data can be collected to support AI agents in such health systems. This fragmentation in healthcare delivery has already been shown to be problematic during the current pandemic. Unlike other countries with centralized national health systems managed by skilled technocrats and medical professionals, the U.S. Centers for Disease Control was not able to aggregate COVID-19 data for rapid, rigorous analysis from across America's numerous and disconnected health networks. The use of highly effective artificial intelligence agents in healthcare will rapidly become a reality in countries that can overcome these challenges through comprehensive national health systems that provide ubiquitous coverage to all their citizens, along with effective cooperation between their government and health sector. For government officials charged with the solemn ethical responsibility of achieving equitable public health, countries must create a nationwide AI ecosystem that can reap the benefits which only vast volumes of consolidated patient data can enable. Government and public health officials also need to build confidence with patients from minority populations that the introduction of AI agents will result in improved care that will grant equitable access. It will be critically important that these officials be transparent about what the use of AI in health systems will mean for individual patients. They will need to listen to and resolve numerous data privacy concerns of patients from minority populations who often lack trust in what is a well-intentioned health system initiative due to documented historical failures in this regard. In summary then, representatives from both government and industry will need to develop educational programs that inform all stakeholders in the public health sector of the importance of AI in the improvement of public health. They will then need to work together to overcome the numerous challenges before these extraordinarily beneficial ideas can be implemented for the nation. Thank you for spending some time with me. I'm trying to follow the TED Talk format, and so I'm keeping these podcasts under 20 minutes. Let me know what you think. I hope you'll find these insights into artificial intelligence helpful, and I hope you will read my new book, The Genome Affair. It's on Amazon. Until next time then, this has been the AI and You podcast with author Vicar Saidi.